Hi, and welcome back to Perspectives. I'm Ellie Ballard, and today we're going to be talking about the issues and challenges in corrections. The field of corrections is a vital component of the criminal justice system. It's tasked with balancing punishment, rehabilitation, and public safety. However, this responsibility comes with significant challenges that affect incarcerated individuals, correctional staff, and society as a whole. From the mental health crisis and barriers to reentry to workforce struggles and the complexities of drug-related sentencing, these issues highlight the urgent need for systemic reform and innovation. This presentation will explore some of the most pressing issues in corrections today, shedding light on the obstacles and opportunities for creating a more effective and equitable system.
Individuals with mental disorders are grossly overrepresented in corrections. It's estimated that only 18% of the general population has a mental disorder. However, it's estimated that 44% of those in jail and 37% of those in prison have a mental disorder. But that doesn't tell the complete story. Unless the disorder is evident or is self-reported to correctional staff, it very likely will go unrecognized and therefore untreated. When an individual is formally processed into the system, they go through mental health screening, which is great, but it is typically a checklist screening that requires the individual to self-report symptoms, and the screening is usually conducted by a correctional officer, untrained in mental disorder. Complicating matters, individuals often lack insight into their own disorders. That is, they do not understand or realize that they have a mental disorder. Now, mental health can be expensive to treat. Psychotropic medications are often required and can sometimes be extremely expensive, especially new generation drugs. Because of this, individuals are often placed on older, cheaper, less expensive drugs that often come with significant side effects. Even if the individual already has a medication that is working to control their symptoms, the system often requires inmates to fail first on cheaper, less effective medications before prescribing a new, more expensive or more effective drug. When you consider the time it takes for psychotropics to break the blood-brain barrier and then the tweaking of dosages that people go through, an individual could be on a drug that is not working for them for years. As you can imagine, this can lead to significant behavioral issues. Jails and prisons aren't great environments for individuals with mental disorders. They're loud, they're chaotic at times, sometimes lit 24 hours a day. An environment that invites an individual with mental disorder to decompensate. Those individuals who are decompensating and untreated may have difficulty following rules, following commands from correctional staff, and may act in ways that irritate other prisoners, provoking an attack, or they may even be violent themselves. As a result, individuals with mental disorders serve much longer sentences, and then they're not eligible for early release because of their behavioral issues, or they rack up new charges while in prison. And after they're released from incarceration, people with mental disorders face many barriers to successful reentry into the community, such as lack of health care, lack of medication, lack of job skills, lack of education, lack of stable housing, and poor connection with community behavioral health providers. These factors increase their probability of rearrest. Studies show that individuals with a diagnosed mental disorder generally have higher recidivism rates compared to those without a mental illness. Now, there's a new way of thinking. It's called therapeutic jurisprudence, and it's the recognition that the law and the criminal justice system have a huge impact on offenders that extends well beyond their involvement in and experience with the criminal justice system. This recognition gave rise to treatment courts, including drug court, mental health court, veterans court. These court programs divert offenders away from incarceration and into treatment. Although a relatively new program, research has demonstrated that these treatment courts are effective. They reduce recidivism and they operate at a fraction of the cost of incarceration. Rehabilitation and educational programs are essential for addressing the root causes of criminal behavior and preparing incarcerated individuals for successful reentry. Drug treatment programs in particular play a critical role in breaking the cycle of addiction and recidivism, especially for those with co-occurring mental health disorders. Rehabilitation and education is extremely important. These programs help individuals develop valuable skills. Programs like GED classes or vocational training and cognitive behavioral therapy helps individuals acquire tools for employment and reintegration. These programs have shown that they can reduce recidivism. Research shows that participation in educational or rehabilitation programs while incarcerated significantly reduces the likelihood of reoffending. But, like all good things in the criminal justice system, there are significant barriers to access. Rehabilitation programs, including drug treatment, are often the first to face budget cuts. Overpopulated facilities prioritize security over rehabilitation. Many of these programs are only available to low-risk, low-need offenders, not necessarily those who really need them, high-risk, high-need. There's also inconsistent access. The availability of drug treatment especially, but most rehabilitative and educational programs vary widely across facilities, leaving many in need without any support. In other cases, the programs aren't delivered by qualified persons or only pieces of programs are sporadically delivered. Now, probably the most egregious, offenders who have been diagnosed with antisocial personality disorder are often not eligible for any treatment or rehabilitation program. This is because it's believed that their behavior is unmodifiable. This is just simply not true. While these individuals can be resistant to change and can be difficult to treat, cognitive behavioral therapy can be effective with this population. But not treating individuals with antisocial personality disorders is problematic for another reason. Offenders who are difficult during screening are often misdiagnosed as antisocial just because they weren't cooperative. Additionally, if you look at the symptoms of PTSD, there's a lot of overlap with antisocial personality disorder. The behavioral signs that led to the misdiagnosis are often trauma-based rather than a true personality disorder. If we look at drug treatment in prisons, we see high demand and limited availability. Approximately 65% of incarcerated individuals meet the criteria for substance use disorders, yet only about 11% receive treatment during incarceration. Access to medication-assisted treatment, MAT, such as methadone, is really rare, despite that it's proven effective. As we discussed on the last slide, many inmates with substance use disorders also have a co-occurring or underlying mental health condition requiring comprehensive care that addresses both the mental disorder and underlying mental illness as well as the drugs and alcohol issues. Without such programs, these individuals are more likely to relapse and reoffend after release. Now, all of this doesn't mean that there's not success stories. Facilities that offer evidence-based drug treatment programs, such as therapeutic communities or substance use education, they report better outcomes in reducing recidivism and improving the inmate well-being. There's an urgent need for evidence-based programs. Programs like drug courts and medical assisted therapy in these correctional settings. They've been shown to reduce drug-related recidivism. And cognitive behavioral therapy and trauma-informed care are crucial for treating individuals with histories of addiction and mental health issues. Access to adequate health care is a fundamental human right, yet it remains one of the most significant challenges in the correctional system. This issue becomes particularly urgent for vulnerable populations such as those with chronic illnesses and pregnant individuals. More often than we'd like to admit, there's inadequate health care for individuals, especially in prison. The system is plagued with limited resources. Budget constraints, staff shortages, and a lack of qualified persons have led to delayed or inadequate treatment. This is dangerous when we consider the prevalence of chronic conditions among this population. There is a high prevalence of diabetes, hypertension, infectious diseases like hepatitis C and HIV, and as we've already mentioned, mental health care gaps. Inadequate psychiatric care exacerbates issues like untreated trauma and addiction. One of the truly problematic areas is pregnancy in prisons. The unique health care needs of pregnant women go unattended to. Pregnant inmates often receive substandard prenatal care. Now, despite bans in many jurisdictions, shackling during labor and delivery still occurs. It raises ethical alarm bells and increases the risk for all sorts of health concerns. More recent research has even demonstrated that the separation of mother and child can result in not just emotional injury, but physical injury to the mother and child. Yet, most incarcerated mothers are separated from their babies shortly after birth. Now, this impacts both maternal and child well-being. Now, there is good news. The problems associated with healthcare in general, it's getting attention. There is advocacy for improved standards. Some states have enacted anti-shackling laws and programs allowing nurseries for incarcerated mothers. There are calls from within and external to the system for comprehensive health policies that align with community care standards as well. The aging prison population is a growing concern in the U.S. The demographic shift is largely due to longer sentences, harsher policies from the tough on crime era, and the natural aging of incarcerated individuals. Older inmates present unique challenges, particularly in healthcare and cost. We typically define the aging inmate as inmates who are 50 and older, but many prisoners exhibit accelerated aging. This is where health conditions are equal to typical individuals who are typically 10 to 15 years older in the general population. Largely, this is due to stress. It could be poor pre-incarceration health care and even the prison environment. As you can imagine, healthcare needs and costs are enormous. Older prisoners often require treatment for chronic conditions like diabetes, hypertension, arthritis, and even dementia. There is an increasing need for specialized care like long-term care facilities, hospice programs, and mental health services. And the costs just continue to rise. The annual cost of housing an elderly prisoner is estimated to be 2 to 3 times higher than that of a younger inmate. This includes medical expenses, facility modifications, and staffing for geriatric care. Now, adding insult to injury, there are facility challenges as well. Many prisons are not equipped to handle the mobility needs of older inmates, such as wheelchair ramps and accessible bathrooms. Older facilities may require costly retrofitting to meet these needs, further straining correctional budgets. Now, there are calls for reform, in particular compassionate release programs. This is where they advocate and argue for the release of nonviolent elderly prisons who pose really a minimal public safety risk. There are also alternatives to incarceration, such as increased use of parole or community-based care. That can be problematic as well. Policy changes are also helping. Reducing mandatory minimum sentences and offering health-focused interventions are really making strides in this area. Solitary confinement, often referred to as segregation, involves isolating inmates for 22 to 24 hours a day in a small cell with minimal human contact. While it's primarily used for managing safety concerns and punishment, its application has sparked significant debate. Solitary confinement is typically used as a disciplinary tool for rule violations within prisons, but it's also used for protective custody, to safeguard vulnerable inmates, and to manage high-risk individuals, for individuals who may pose a threat to themselves or to others, or just more generally to security. Solitary confinement takes a toll on individuals. There are significant psychological and physical effects. We see mental health deterioration. Prolonged isolation often leads to anxiety, depression, hallucinations, and suicidal ideation. There's a loss of social skills. Because of this lack of interaction, it hinders reintegration upon release, and there are significant physical health effects as well. Limited movement can cause muscle atrophy, and of course, all of the other health problems that a sedentary lifestyle bring. There are growing ethical and legal concerns in regards to the use of solitary confinement. First and foremost, solitary confinement raises questions about human rights, especially its use on juveniles, pregnant women, and individuals with mental disorders. In fact, the United Nations considers prolonged solitary confinement, that is, confinement that exceeds 15 days, to be a form of torture. The effects of solitary confinement are gross when we consider its efficacy. Although there's debate, research has demonstrated that solitary confinement has limited deterrent effect, and long-term harm is substantial. Some states have enacted laws restricting solitary confinement for vulnerable populations and limiting its duration. But there's also a push for alternatives. Some examples include restorative justice programs, increased mental health interventions, just improved staffing, and training for de-escalation. What if I told you that 44% of offenders released from prison will return to prison within a year? Or that an additional 25% will return to prison within 3 years? It's a shocking statistic. It means that within 3 years of release, 69% of people released from prison will commit a new offense and return to prison. This is the recidivism rate and is often referred to as the revolving door of prison. This rate is relatively unchanged from year to year, regardless of policies or the political tides of the moment. It's terribly stubborn. It makes you think that maybe the sentence and the punishment really isn't the problem. Maybe it's how we release offenders into the community once they've served their sentence. Now, individuals released from prisons, they face enormous barriers as they reenter society. As you can imagine, finding employment is a huge hurdle for someone just released from correctional supervision. A criminal record significantly reduces job opportunities due to the stigma and legal restrictions. And many formerly incarcerated individuals lack recent work experience or skills that they need in today's job market. In addition to employment challenges, many have housing difficulties. There are public housing bans for individuals that have criminal records. There's landlord discrimination. And this may leave somebody without stable housing. Have you ever filled out a rental application that required a background check? More and more apartments and landlords are requiring such a check and denying housing to those with criminal histories. Now, unstable housing is important because it increases the likelihood of reoffending. Likewise, education and training can present a barrier to successful reintegration. While in prison, access to rehabilitation and educational programs are often limited. Post-release, these individuals may struggle to access higher education or vocational training due to financial and systemic barriers. As we discussed at the beginning of this lecture, many individuals leave prisons with untreated mental health issues or substance dependencies. A lack of affordable, accessible treatment exacerbates these challenges. Legal and financial obstacles are often the cherry on top. Parole conditions are often strict and difficult to comply with, especially for those lacking resources. Many have accumulated debt from fines, fees, and even child support. This can create additional stress and economic hardships. Let's talk a little further about parole and probation conditions. Annually, at least 128,000 people are incarcerated for such non-criminal technical violations of probation and parole. These supervision violations accounted for 27% of all admissions to state and federal prisons. Strict parole conditions can create several problems for parolees, including difficulty finding stable housing, difficulty finding employment, limited social support due to the restrictions on associating with certain individuals, increased risk of technical violations leading to reincarceration and overall hindering successful reintegration to society often disproportionately impacts marginalized communities. This is really due to complex social networks and limited opportunities. Now, there are some key issues here that really mirror barriers to reentry, but strict parole conditions can exacerbate these barriers significantly. There are barriers to employment and housing. Parole conditions that restrict where former inmates can live upon release often include limitations on a geographic area, requiring prior approval to change a residence, prohibiting living within a certain distance of schools or a victim's home, and restrictions on residing in specific neighborhoods depending on the exact nature of their crime. Some conditions prohibit contact with people who have criminal records. These restrictions can cut parolees off from their support systems, making it harder to maintain positive relationships and access necessary assistance, leading to social isolation. Strict reporting requirements and rules can lead to technical violations as well, even for minor infractions, which could result in returning to prison despite not committing a new crime. The stress of navigating complex parole conditions can exacerbate mental health issues. It can hinder rehabilitation efforts. Now, strict parole and probation requirements disproportionately impact marginalized communities here again. This is really due to factors like concentrated poverty and limited access to resources. Overly strict conditions may actually prioritize punishment over providing opportunities for rehabilitation and reintegration. Some examples of problematic parole conditions include things like association restrictions, right? Prohibiting contact with anyone who has a criminal record, even family members. There are curfew limitations, strict curfews that will interfere with employment or educational opportunities or even treatment. Now, there could be strict drug testing requirements, frequent drug testing that can be difficult to comply with even for individuals in recovery. And they pass those costs along as well. Geographic restrictions, so they prohibit residents in specific areas, so it makes it difficult to find housing. These almost impossible conditions has led to a phenomenon that we call maxing out. Maxing out simply means that some offenders are opting not to seek early release. They're preferring to serve their entire sentence rather than accept parole conditions that they may find too restrictive or punitive. Now, this is problematic for really a number of reasons. Individuals released after maxing out are not assigned parole officers or reentry programs leaving them to navigate the whole reintegration process entirely on their own. Without the transitional support that parole often provides, they may face greater difficulty finding housing, employment, or accessing services like mental health or addiction treatment. Now, this lack of structured support increases the likelihood of reoffending, and it perpetuates this cycle of incarceration. Lastly, let's just talk about some workforce issues in corrections. Many correctional facilities face severe understaffing, leading to overworked employees and compromised safety for both staff and inmates. High turnover rates exacerbate these shortages, and many leave for less stressful and higher paying jobs. Correctional officers are often among the lowest paid law enforcement personnel. And limited benefits, slow wage growth make the profession less attractive, especially given the risk and demands of the job. Working in corrections is highly stressful. You have exposure to violence, threats, trauma, the emotional toll of managing incarcerated individuals, often with mental health or behavioral challenges. Long hours, mandatory overtime in understaffed facilities. These stressors contribute to high rates of burnout, mental health issues in the correctional officers themselves, and even PTSD. Negative public perceptions of correctional work deters potential applicants. A lack of career advancement opportunities further discourages long-term commitment to the field. Understaffing and burnout directly affects prison operations. It leads to increased risk of violence, limited access to rehabilitation programs, and strained relationships between staff and inmates. Over time, these workforce issues contribute to a cycle of dysfunction in the correctional system. Raising wages and improving benefits could attract more qualified staff and retain them. Just providing resources like counseling and peer support could even reduce burnout and improve just the well-being of officers. Offering ongoing education and clear career paths can help build a skilled and motivated workforce.
Okay, this concludes our lecture. Thanks for joining me, and as always, if you have any questions, please feel free to reach out.